My joy for 2021 was that I got to go skydiving with one of my patients. He and I kind of struck up this kind of friendship, and before the pandemic, he was already trying to get me to do this. And I said, for your 95th birthday, I'll do it with you.
It's been a daily exercise of being able to show compassion and grace for your fellow colleagues through all of this. I think the biggest challenge is what we've seen as society, and it's having to change at a moment's notice. And so our work had to change.
To me, this constant ability to adapt to challenges and create opportunities while remaining focused on sharing medical information and constantly collaborating to provide excellent patient care, to facilitate innovation and further education, is how I've seen ACC's mission come to life.
I would have to say that telehealth was one of the biggest avenues for continuing evidence-based management for these patients that we really were not doing before.
I remember this summer I had an adult patient that was diagnosed with a sinus venosus defect and partial anomalous pulmonary veins, and upon further evaluation, she was found to have pulmonary hypertension. We were able to treat her pulmonary hypertension, and on further evaluation, she was meeting criteria for surgical repair. She successfully underwent repair. However, post-operatively, we were in the middle of the current COVID-19 surge with the Omicron variant. So we offered her telehealth visits for her post-operative follow-up, and she and her family were very grateful to be able to continue to get cared for without taking the risk of getting exposed to COVID in the hospital. And she's been doing great. She's home and with her family, and they were very thankful for us to be able to offer that flexibility in her follow-up.
We're putting valves in people in their 90s. We're treating really complicated coronary artery disease. We're looking at what other valves we can fix without having to open up patients. And what the result of that is to have a patient like mine be there and still have that quality of life.
It's important to hear your patients. It's important for your patients to understand their condition. And it's important for you to be willing to work with their challenges, whether that be challenges in understanding the particular nuances of their medications, or if it's something that is much more devastating, like a challenging social determinant of health indicator.
There has been a lot of disparity as far as access to vaccines and willingness to get vaccinated amongst different communities.
I've had patients with complex congenital heart disease ask me if the vaccine is safe. And these are patients that we've cared for over many years and developed a relationship and immense trust that they have in our team. And our challenge was, how do we use this platform of trust to share medical information about the vaccine in a way that we can empower our patients and making them feel more confident in receiving the vaccine.
My takeaway from my experience during COVID-19 is that it really takes a village, and that there's just so much information out there and so much more to learn.
We have learned so much more about each other through this course of time and dealing with this pandemic. And I feel that we have united a little bit more than we probably ever have to make sure that, particularly in medicine, that we are doing the best that we can for our patients.
I do think like a good component of well-being for all of us, whether you're a clinician or not, is to find those joyful moments. My moment of joy may look very different than someone else's, but we need to celebrate the wins.